All right. Well, good afternoon and good morning, I guess, depends on where you're at. So, really welcome everyone to this exciting joint seminar hosted by the UBC Edwin S.H. Leong Centre for Healthy Aging and the U of T SickKids Edwin S.H. Leong Centre for Healthy Children. I'm Michael Kobor, the inaugural director of the S.H. Leong Centre for Healthy Aging, and it's really my distinct pleasure to open and moderate today's session. I'd like to acknowledge that here at the University of British Columbia, we're gathered today on the traditional, ancestral and unceded territory of the Musqueam people, and I'm honored to live, work, and learn on these lands. In addition, since this is obviously a virtual seminar, we have people joining from many locations across the country, from coast to coast to coast. And I acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. So today we're really delighted to bring together two series, the Healthy Aging Research Seminar Series and the Leong Centre Rounds, each dedicated to advancing critical areas of health, research, and policy for today's talk. And the joining of these two seminar series allows us to bring together experts in child health, equity, and healthy aging, creating really a unique opportunity to span that arc between childhood and later life and anything in between, and to bridge the generational health perspective, fostering holistic approaches to well-being across the lifespan. And obviously, we'd love to everyone to encourage to be actively participating in the discussion, ask questions, seek out potential collaborations, because that's always one of the exciting things in joint seminar here. It's not just about sharing knowledge, but also about building connections that can hopefully lead to impactful change and such. And today, it's a real pleasure, and we're pleased to welcome Liv Mendelsohn, the Executive Director of the Canadian Centre for Caregiving Excellence, which is a program of the Azrieli Foundation, where she leads innovation, research, policy, and program initiatives to support Canada's caregivers and care providers. So Liv has an extensive biography. I'll do my best to sort of summarize all the highlights.
No need.
But she's a visionary leader with more than 15 years of experience in the nonprofit sector and has been a lifelong caregiver, and has lived experience of disability. Her experience as a member of the sandwich generation fueled her passion to build a caregiver movement in Canada to change the way that caregiving is seen, valued, and supported. Over the course of her distinguished career, Liv has founded and held several organizations in the disability and caregiving space, including the Walker Green Center for Accessibility and Inclusion and the Real Abilities Toronto Film Festival. So very eclectic mix and exciting. Liv has also served as the chair of the City of Toronto Accessibility Advisory Committee, has received the City of Toronto Equity Award, and has been recognized by University College at U of T, Empower Kids Ontario, and the Jewish Community Centers of North America for her outstanding leadership. And she's a senior fellow of the Massey College and a graduate of the Mandel Institute for Nonprofit Leadership and the Civic Action Leadership Foundation Diversity Fellowship Program. All right. Well, Liv, lot you have to offer us, and we really look forward to your presentation and the discussion afterwards. So thank you so much for joining us.
Thank you for having me. I'm so pleased. I've collaborated with folks at both centers, and I'm so pleased that you meet together and do this. Our work really is focused on care across the lifespan and integrated care, and the fact that, your two sectors are coming together regularly is really exciting. And I will momentarily start the presentation and share my screen, but I'm just going to let you know right off the bat that the data I will be sharing with you today is, in a sense, open data. We share it with researchers. So as you go through the presentation with me, do think about ways in which this might be helpful in your own work. We're very happy to share with you, and we're indeed doing some writing and publication with folks already involved with Leong Centers. So without further ado, I'm going to get my screen shared. Bear with me for one moment. There we go. And you'll let me know that you can see it. All right, off we
Perfect.
go.
Perfect.
Wonderful. So, a quick word about who we are. As Dr. Kobosh said, I am a caregiver myself. I suspect many of you are, and we'll talk in a moment about why I suspect that. We are embedded within the Azrieli Foundation. The vision for this center was in the works prior to the pandemic, but was really accelerated by what we saw happen with caregivers, by which I mean the unpaid family, friend, chosen family who support a patient through their healthcare journey, and care providers, the frontline, often undervalued and often unregulated personal support workers, disability support professionals, home care workers who do that intimate care and often become part of that family care system. So we are a program of the Azrieli Foundation, and we support and empower family caregivers and care providers, advance the knowledge and capacity of the caregiving field, and advocate for effective visionary social policy with a disability-informed approach. And really, we see caregiving, as you'll hear, as the next frontier of public policy in Canada. And given that we're meeting the day after an election, I'll be peppering some of my remarks with some of that. So I'm going to share with you a little bit, actually quite a bit, about the state of care in Canada right now, why we thought it was important to work on, a national caregiving strategy, a little bit on what's in the strategy, and then the big care movement and advocacy campaign that is a part of this work. And I won't be checking the chat, but others will. So do include all of your thoughts and questions as I go along. So very quick overview. Our contention is that caregivers and care providers are the backbone of Canadian society. If caregivers went on some kind of strike, our healthcare system would fall apart by noon on the first day. It truly, caregivers are unseen and truly the sort of glue that keeps our somewhat fragmented and sometimes broken systems together. 1 in 4 of us is a caregiver today, and half of us will be a caregiver at some point in our lives. And when we say caregiving here, I'm not speaking about childcare. I'm speaking about care for a spouse with an illness like cancer or diabetes, a child with a disability or complex medical care, an elder with needs related to aging. So that's sort of the picture of caregiving we're talking about. And of course, when caregivers struggle, and the data bears this out, as we'll learn shortly, the health outcomes for care recipients worsen. Um, Really critical stat, 3 hours of care are provided for caregivers for every hour provided by the healthcare system in Canada. And here come the scary numbers. 72% of caregivers, this is an Ontario study, say they feel so burnt out, they're not sure how they will continue. And at the same time, 80% of care providers have considered leaving their job in the last year. So we have a bit of work of a perfect storm on both the caregiving and care providing side. So we decided our center is only about 2.5 years old. That might be why some of you may not have yet heard of us. And we are a funder, we are a convener, and we're an advocacy organization. And one of the things we wanted to do right away was fill some gaps on data. So we supported and consulted with Stats Canada on the general social survey and on some pieces related to caregiving there. But we realized that we needed to do some of our own work. So we put together the first national caregiving survey, and we will be doing a second edition later this year. So we had 2,000 caregivers and care providers, and an additional more than 1,000 responses through an open link, although the data is segregated. So I'll be speaking to the data from that 2,000 cohort or group that Leger did with us. Whoops. Okay. So just to give you a sense, you're probably intimately familiar with this from your work and from your own lives, but caregivers provide an average of more than 5 hours of care a day. You add that up, that's that's almost a second full-time job. And the average years providing care are more than 4 years. So often we think of care as an acute period of care, whether it's end of life care or illness care. Caregiving can be long, it's very often episodic, and our policies and systems don't really account for that, as I'll speak to. And caregivers and care providers support with a range of different activities, and you can see some of those listed here. What caregivers need. So 4 of 5 caregivers said that free counseling and mental health supports were important for supporting caregivers. That's no surprise when around 2/3 of caregivers told us they struggle with their mental health, with depression, and with anxiety. Um, More than 3/4 told us it would be important to have a healthcare provider assess and track their well-being. We hear this all the time from caregivers. I bring in my father, my sister, my son, whoever the person may be, to all of these appointments. No one has ever asked me how I'm doing. That is a very common issue. And so we're not taking a baseline of caregiver wellness, and we're not following them along the journey of the person that they're caring for. So we are missing opportunities to intervene and support, and both the caregiver and the care recipient then suffer. And most caregivers currently are getting their information from that family doc, some online. We hear a lot about Googling things at 3 in the morning when you're trying to figure out, how to pay for incontinence supplies and nutritional supplements and pay the rent at the same time, all of those unforeseen costs that come along with care. And social workers, particularly when people have been in acute care or residential care settings. And again, we are beyond burnt out, but we have no choice but to keep going 24/7 is an echo of something we hear quite a bit. Um, on the that tracking and assessing and working with caregivers, there's a great resource I wanted to share with those of you who are clinicians. From the University of Alberta, the Caregiver-Centered Care is a free modularized program that is very, very helpful in both identifying tools and measures and ways to track caregiver wellness, as well as communication and just a whole variety of supports in navigating that care journey. So this is another key piece of information. About 2/3 of caregivers are working, including 46% of those caregivers who are working full-time. So really juggling what we are calling that second shift or that extra shift. And this is particularly true for long-distance caregivers. So those folks who may be newcomers from another country or who may be caring from someone across provinces. We hear a lot about trying to navigate care in another country. As someone who has some skill and proficiency in navigating systems, but those are systems that are happening at 2 a.m. Across the world, and really the struggle of that. Doing that for loved ones. So that's a big issue, particularly in immigrant and newcomer and refugee communities. I think that goes relatively silent. Some caregivers need to work more to cover the costs associated with caring. And so you then see some really troubling stats on people putting off retirement because of care responsibilities, having to take on a second job, working more hours to cover those costs at the very time when they need those hours to do that intense caregiving. So it's really a rock and a hard place for people. And what people have told us, what these caregivers have told us would be helpful is, some flexible work environments, paid leaves of absence that are designed to meet the needs around episodic care, and access to home care services. And we'll talk a little bit more about why that comes up so much as a need and as something that is not working. For those of you who are working with the senior population and the older adult populations, today's caregivers are tomorrow's care recipients. 1 in 5 caregivers is over 65, including that 5% who are 75 or older. they are, no surprise, most commonly caring for partners or spouses, although we do have a cohort of aging seniors who are caring for folks with early onset dementia who are their children, in addition to people caring for adult children with various mental health and developmental and other disabilities. What's interesting about this group is that they are significantly less likely to access services or supports. So they are struggling to find paid care services. They are struggling to find information, and they find it very difficult to access a range of services from home care to Meals on Wheels to supports to apply for benefits. The whole gamut of those wraparound services are very challenging for this group, and they're not accessing those services, though they are a very high needs group. So they are looking for a monthly allowance or benefit and tax credits. They are looking for better navigation supports, and particularly, this won't surprise you, that is not only online based. There are some folks who are very adept with technology who are senior caregivers, and others who find it very challenging that there aren't a wider array of ways to access supports. So for example, to highlight this sense, people mention resources, but an organization that would sit down with you and go over items would be more beneficial, as we elderly are not always technically inclined. And then from a caregiver caring for their spouse, I will soon need extra help as we get older. So really a high needs population that is not doing well in our current system. Caregiving comes at a direct financial cost. More than 1 in 5 caregivers are spending at least $1,000 a month out of pocket. And only 11% of caregivers have received caregiver benefits that are available, government benefits, and only 12% said that the person they care for has received any government financial support. So that's really a troubling statistic. In the past year, 37% experienced financial hardship due to their care duties. And so these are the common stressors and what people are doing to meet them. Stopping saving, using personal short-term savings, taking on more debt, leaving bills unpaid or paying them late, and using short-term savings. And that does not, none of that is particularly sustainable, given that that average care period is, again, 4.6 years. What caregivers need in this area, again, the notion of monthly allowance and care and tax credits came up. For more paid care hours. More than half of caregivers were not familiar with any of the current tax credits related to care. So that's important. Here's another voice of a caregiver. Caregiving when family members are disabled and poor is extremely difficult and expensive. Everything is all on you. Plus, I already gave up my full-time job to be a caregiver, so it's extra hard. I think we need to talk more about caregiving and poverty, and I would certainly agree that we do need to do that. Paid care is in crisis. So these are our care providers that I spoke about at the beginning. Care providers like personal support workers or direct support professionals. 1 in 4 of the folks we surveyed works in residential care, and 1 in 5 in the home of the recipient. And this is a group that really feels that they have been undervalued and ignored and not heard. Obviously, we saw this during the pandemic and the impact of this during the pandemic, but it continues. And those of us who are looking at health and human resources shortages are very concerned about this. So concern about being paid unfairly, having inadequate staffing on their shifts, almost half, while a quarter said they did not feel safe at work. So a large majority have considered changing careers in the last year. We have spoken to care providers who are living in their car, who are driving Uber to make ends meet in addition to being a care provider. And again, folks who are working for agencies are not paid for the time it takes them to go from one home to another if they're doing home-based. And we have people who are juggling the practice guidelines and codes of ethics from multiple different areas of care. So you'll have someone working a home care shift in a home, 3 days a week, 2 days a week in a group home for people with developmental disabilities, and then, maybe some weekend shifts in long-term care. That is a very difficult uh, career to cobble together. And without those requisite benefits, sick days, insufficient, all of that. So you'll see, yes, people are concerned about salary, but they're also concerned about burnout just as much, a lack of benefits, abuse and discrimination, lack of job security, no opportunity for career advancement, and no opportunity for training and education. So feeling as a PSW that if you've mastered if you're a really skilled PSW and you love what you do, there isn't the career ladder that people would like to see, short of perhaps going back to school and getting trained in a registered health profession or in a different segment of the care workforce. So care givers, in this case, care providers, actually, these issues affect family caregivers who are seeking to hire these folks, or who have these folks in their home or in the residences where people their loved ones live. So 63% of caregivers who tried to hire high quality care providers found it difficult. And 63% of caregivers who tried to access affordable local care provider services found it difficult. So that is also troubling. And here are a couple of more of those voices. I can't work because I can't find enough care providers to support me, but I still need to provide for my family financially. Also, we desperately need more care aides and nurses willing to work nights in community care. It would be useful to have a list of recognized registered respite providers in my area without having to go out and find one. So again, those issues of navigation and navigating through resources. What care providers needed, and my apologies, I think this slide was supposed to be where the previous one was, but hopefully you'll forgive me. What they're looking for, yes, higher pay, but also flexible scheduling, reasonable work hours, better recognition for their work, and access to paid leave, paid sick leave. And a lot of people spoke about the issue of being unwell, not having any sick leave, and being in other people's homes while unwell, and the ethics of that, the concern around that, a big issue. I will share that a second phase with this survey is almost done at the University of Toronto with Dr. Ito Peng and her team doing qualitative follow-ups. So there'll be a lot more data coming out early next year. But some of these caregiver voices gives you a snapshot for the feel of that. More than half of care providers said that they would feel more supported at work if they were in a union. So that's very interesting. And 57% of care providers do not feel supported by the government in their work. And as I'll speak to, that came up during this past election. And here are, again, some of those voices. We are doing so much in the healthcare system and not being recognized financially for it. It says that healthcare staff are not valued or important in a public health system. The failing healthcare system can't be bandaged together anymore by nurses and care workers. We have done this for years and just can't keep up anymore. So you're getting some of those alliances with nurses in there too. Caregivers have diverse experiences, but shared needs. So just to give you a little bit of this data, we know, of course, that where there are more barriers and multiple barriers, A lot of this will heighten the impacts on caregivers and care providers, of course. So just to give you a taste of some of the data, racialized caregivers were significantly more likely to have experienced financial hardship due to caregiving, 46% compared to 34% of non-racialized caregivers. Women caregivers are significantly more unlikely to be unfamiliar, more likely rather to be unfamiliar with tax credits related to care, 54% compared to 48% of men. Neither of those numbers is particularly promising, but it is a big issue for women caregivers. And LGBTQ 2S plus caregivers were significantly more likely than heterosexual caregivers to be caring for someone with a mental health condition and to report fair or poor mental health themselves. So these are some windows into some of the targeted responses and some of the work that needs to be done and co-designed with these communities to meet these needs. Caregivers across identities and communities are interested in mental health and financial supports. And tell us again, these need to be both targeted and broad responses. And many groups of caregivers had higher interest in free counseling and mental health supports compared to the rest of the participants: women, low-income caregivers, Indigenous caregivers, and LGBTQ2S plus caregivers. So no surprise, things like language barriers, an issue. Translation service is hard to find. My parents don't speak English. When they go to hospitals or go to see doctors, they need translation services. My wife passed away a few months ago. It has been impossible to find a safe space to get support in a group setting, online or otherwise, for the loss in a lesbian relationship. So lots of concerns there that need further exploration. So bringing all of this together, caregivers and care providers have provided what we think is a pretty clear policy agenda: more accessible mental health supports and stronger support pathways, caregiver-friendly workplace policies and employment laws, like caregiver-specific leaves and flexible working arrangements, better service navigation and access to home care services to connect seniors to the supports that they need, direct financial compensation for caregivers, which is common in other countries, in the UK, in Australia, in a number of Nordic countries, but also there is a US state that does this. And there are our Atlantic Canadian region has some monthly caregiver benefits. In Nova Scotia, New Brunswick is putting one together. PEI has one, Newfoundland has one. So that is an area to watch across the country. And our contention is that a national caregiver benefit would be in order here, given the outlay and the challenges with work that caregivers have. Improve care provider working conditions through actions like increased compensation and sector coordination, and deeper dive into the experiences and needs of different caregiver demographic groups. So from the survey told us many things we knew anecdotally, many things we suspected, but also had some surprises for us, and really informed, together with a variety of other inputs, our work towards a national caregiver strategy. So I'll just share with you some of those inputs. So in putting together the survey itself, we worked with Caregivers Can, the Canadian Advisory Network, which has caregivers across the lifespan and across geographically across Canada, to put together the survey questions, along with our advisory panel of researchers who helped us put the survey together. And with the National Caregiving Strategy, we spent about 18 months working with our own tables of young caregivers, military and veteran caregivers, working caregivers, a variety, our Indigenous Care Collective, a variety of groups that we regularly convene, and also many, many partner agencies, including our affiliate provincial care caregiving organizations, Ontario Caregiver Organization, Caregivers Alberta, Family Caregivers of BC, Caregivers Nova Scotia, Caregivers New Brunswick, and L'Appui Quebec, our Quebec caregiving organization, to really co-design this strategy and to make sure it reflects, and not just reflects, but really is made of the priorities of caregivers and care providers on the ground across the country. So I'll turn to speaking a little bit about that. I know we've just had an election, and I will speak to that, but we were happy to see the previous government include in Budget 2024 the first reference to the care economy and the need for a national caregiving strategy and a sector table. I guess I'll pause here and just speak about the election. We did have from all five national parties various commitments to a national caregiving strategy and to specific measures like making the caregiver tax credit refundable. That would be helpful to caregivers. So there is widespread support. Um, as I said, putting this together, we had 31 convenings, 44 consultation meetings, and we had more than 1,500 online forms completed. So we feel we did get a fairly good breadth across the country and in particular demographic groups. And we did some oversampling both in the survey and in the strategy work with Indigenous caregivers and with LGBTQ plus caregivers, really trying to make sure that we got and northern, rural, and remote caregivers as well, that we got a good understanding of needs across the country. Just to give you a sense of the agencies and researchers who sat with us as we developed the National Caregiving Strategy, really across the aging, health, and disability sectors, and from pediatric and medical complexity organizations through to lots of healthy aging and dementia. And then, of course, illness groups like diabetes, cancer, heart and stroke. So a wonderful group of people came together to work on this strategy. And I'll speak to it now. So there were 5 pillars to the strategy. There are 5 pillars: improving supports, programs, and services for caregivers, including some targeted mental health supports for caregivers, care insurance, which exists in Germany and South Korea and in Japan and many, many countries. And there's some great models to look to plan for and public care insurance to manage the costs of care so that they don't become something that really a family can't meet and hasn't planned for. A national caregiving benefit, which I spoke to, and I can speak more to if there are questions about it, and making the existing Canadian credit a refundable one so that regardless of your income, it's meaningful and helpful. Supporting caregivers in work and education. So we heard from people who were making their care decisions, their career decisions based on care. We heard from, for instance, medical students that couldn't apply to med schools beyond their local area because of their caregiving duties. Lots of people struggling in post-secondary education to manage the needs of caregiving and planning for their future. We know that women are particularly penalized in the workplace during their peak earning years. They're often caring, taking time out to care for people that they love, and often losing pension contributions. So I'll speak more to that, but CPP reform is a big piece of this. It's something that falls not only on women, but heavily on women, and also missing out on time periods for advancement in careers. And I'm sure some of you listening to these calls who are caring for someone in their life, with a disability or someone who is aging have experienced this firsthand. We know particular interesting case studies around double duty caregivers, so people who are working in the health system, providing care all day, and then going home and doing another shift of care for their loved one is another particularly vulnerable group for burnout and for mental health impacts. And EI reform, right now the caregiving leaves are inadequate. The end of life leave, for instance, takes so long often to access that we've had many people tell us that by the time they were able to access that, the person that they were caring for had already passed away. So they missed out on that period of time towards end of life when they would have liked to do that more intensive caregiving period and care for them. So that is not working well. Support for recipients of care. One of the things that both caregivers and care providers tell us regularly is that if there was better support for the people they're caring for, that's their top priority. That would make their care easier. So disability tax credit reform. I'll spare you all the details, but a suite of things that would support, particularly around disability benefits, that could be much improved. Sustainable care provider workforce. So our previous government had committed to a $25 minimum wage for PSWs, although that has not rolled out adequately. And we think that should be true for all care providers, whether they're a PSW or a disability support professional or a home health aide, having living wages so that we don't have care providers who are living in their cars, in some cases living in shelters and trying to do this personal and intense work. And then government leadership and recognition. So in government regulated professions, also in the purview of veterans, where government has federal government has a big role in healthcare. Lots and lots of interventions that are possible. We had broad support for this work from particularly from the Liberal, Conservative, NDP parties, also from the Bloc and the Greens as well. I do think this is going to be an exciting piece of social policy that, whether it's a minority, and I don't know, it's 1:30 p.m. here. I'm still not sure whether we have a minority or a majority government, but in either circumstance, given that 1 in 2 Canadians will be a caregiver and 1 in 4 is now, this is an issue that affects every Canadian family. I think we are likely to see some really good work here. We have really seen ourselves as part of launching or building on a care movement in Canada, doing a lot of advocacy. So this was the launch of our Caregiving Caucus, which has members from all 5 federal parties. About half of these folks have been reelected. Some of them are not pictured. And we're eager to reconvene and restructure and reconnect with our Caregiving Caucus. And I will share with you, actually, I won't, because I think let's see if I remember to press sound. But if not, I'll send you the link where you can see it. But this is our Act on Care campaign. Trying to see if you can hear this.
My son's diagnosis turned caregiving into a full-time job. I was exhausted and isolated. Parenting is a joy. Caregiving is a job. No one should have to fight this hard to care for their loved ones.
For over 10 years, I cared for my dad with Alzheimer's. As an only child, I took on everything, but at a great cost. The system doesn't make it easy. Caregivers like me are often forgotten. We overcommit, neglect our own needs, and face burnout.
When my mom was diagnosed with dementia, I was a university student with no support. I juggled caregiving and studies, feeling lost. Now, as someone who supports caregivers, I still face the same struggles.
I ignored my own well-being for years while meeting my son's needs. There was a lot of weight on me. Families like mine cannot go on without better support.
I work 24/7 as a live-in care provider, managing every detail of my client's life. I love what I do, but I struggle financially, and my status as a new Canadian remains uncertain. Caring for seniors should be respected and valued.
More than 8 million Canadians give their all as caregivers, yet they're left with little support. Now, thousands of Canadians have united to design a new National Caregiving Strategy, a united call for change, ensuring caregivers get the acknowledgement and support they deserve. Financial relief, workplace support, better access to benefits, respect for paid care providers, federal leadership. Support for Canada's caregivers can no longer wait. It's time to act on care. Add your voice to make caregiving a national priority.
So we've had about 15,000 Canadians, again, during this election period, sign up. We will be keeping this campaign going, and we'll be doing a first 100 days campaign as well. Whoops, no, you do not need to hear that again. So this is the messaging that goes out. We really want to help caregivers recognize that they are caregivers. That's a big step. Often, you think of yourself as a daughter or a wife, or, that relationship, of course, is primary. And it's only when you become sort of past the point of burnout that you start to identify as a caregiver who has specific needs and really deserves specific support. So we're trying to help people recognize themselves as caregivers, get access to those things that they need, like those financial supports, like that respite, like that mental health support, and like that navigation support, all of those pieces. There we go. So I will stop sharing there and open it up for discussion.
Great. Thank you so much, Liv. Not sure how we're doing this. Can people speak up, or are they typing? Are people just allowed to type things in the
People are welcome to
chat?
do both, Dr. Kapoor. They can either raise their hand or they're welcome to add a comment in the chat box. I'm happy to keep an eye on the chat box for you as well.
Beautiful.
And I'll just comment while people do that. I see a couple earlier comments. Yes, I'm happy to share the slides, and yes, we'll make the once it's out there and complete, we'll make the qualitative data also available for researchers to access. And I didn't obviously go into all the joys of crosstabs and analysis, but we've pulled data on kids with medical complexities. We pulled specific data on dementia. We've pulled specific data on arthritis for various partners. So we're very happy to share and to open it up. And I'll also blather on just a little bit more about the political moment that we are in. As I said, we're relaunching our caucus. We have our summit in Ottawa in November. And what we're trying to do, whether it's with CIHR or PHAC or at various levels, is, it's wonderful to see the lived experience of patients recognized. What we're trying to do is also look at that whole system of care that supports a patient, so that whether it's patient engagement is in research, extending it to patient and caregiver, whether it's family or chosen family engagement in research, to really help people with lived experience share what they have to offer, and to help researchers frame those questions in ways that include that full nexus of care. So I'll just review the chat a little, or Priscilla, I don't know if you're doing that.
No, there's a lot of very, very complimentary comments and how wonderful your work and your talk was. So
oh, good. Well, I'm glad. I think this might be different than the data you usually dig into, but I think for clinician researchers, I think it's a really important angle to be considering. I'm sure we all do to some extent, but caregivers have told us loud and clear that this is that they want to be part of research. We do have a large group of caregivers who've put up their hands to say, send us all of those surveys from different organizations. Like, we really want our experience to be understood, and we want to be part of shaping the questions that frame the research agenda.
So there's just a question here from Adriana. Adriana, you want to unmute yourself and ask you the question, or shall I read it?
Sure, happy. Thanks very much for the presentation. I was wondering if you could expand a bit more on raising the floor for low-wage care workers. And
yes.
You made reference to living wage and immigration reform. And so I was wondering on how some of these things cross federal and provincial focus and what that looks like over the next year or so. Thanks.
Yeah, and I think with all of these things, obviously there's a big provincial component, and we are doing that work as well, and also advocating, whether it's healthcare accords, wherever these conversations are happening, to make sure that care and caregivers and frankly the care economy is on the agenda. Enhancing protections for migrant care workers is really important. We've seen some recent improvements to some of those programs, but there's a great deal of work that can be done there. And I can go further into looking at how we could use a point system based on people's skills, similarly, as we do with other categories of work, to make sure that we're getting skilled care workers and we are not tying them to one employer who then has control over their status in Canada. Because that is, where we've heard many stories of abuse. We've worked, for instance, with the Philippine Overseas Labor Office, who have been tracking really challenging stories of what can happen when people are afraid to lose their status and so can't speak up about their working conditions, particularly if they're working in someone's home, but also if they're working for an agency. There's a lot of work to be done together with labor on this issue as well. And one of the top things we hear about is improving pathways to permanent residency. That won't surprise anybody, I think, but it's a huge issue. I was speaking to a care provider last week who has been sort of technically eligible for about 4 years, but still is very much in that holding pattern, and it's very hard to live your life that way and to build a life in Canada, and really, again, doing that most intimate personal work with the people that we love, and yet not having those basic protections that the rest of us enjoy. I don't know if that fully answers your question. I can get more into the weeds with you as well, but it is a big issue that we're concerned about.
And then there is Olubode as a question about the summit. I don't know if you want to ask it yourself, or should I?
Yeah, sure. We I can we'll send out a link to the summit, which is a combination of kind of again the state of things from both research, clinical practice across the country, and a public policy lens. So we will have some conversations with various federal ministers once we have them, and also our caregiving caucus and a parliamentary reception. You absolutely can come from outside of Canada. It is fully streamed online as well as in person in Ottawa. It's really important for us that caregivers are able to attend. So we have subsidies for caregivers, but we also know that a lot of people can't leave the person they're caring for. So the idea of coming to Ottawa for a conference is completely inaccessible. So we do have the whole thing streaming online as well.
I had a question for you, Liv, and you alluded throughout a few times about to other countries, and with some of the payments and tax credits and so forth. And I'm always sort of curious whether there's something we can learn from other countries. Is there, from your perspective, one or two countries that really got it right, that were recognizing that Canada, of course, it's very unique in many ways, but I'm just wondering if there's somebody has a blueprint for getting it right that we could, sort of
Yeah, I think
model? Yeah.
the UK is way ahead of us. They've had a caregiver benefit since the 1960s, and a very they're leaders in integrated care and in social prescription and
Mm,
in so many of these pieces. So it's not surprising that they are very mindful of including that caregiver perspective, and that really has uh, been part of their public policy and their health systems policy. So the UK is certainly a leader, and we've done a lot of learning from our friends in the UK at Carers UK. I would have said prior to the recent election in the US that surprisingly, in some ways, that the US is actually ahead of us. Their national caregiver strategy was put together during the Biden administration with an enormous amount of financial with a lot of dollars behind it, and has been really successful. It is in the process of being dismantled, so I guess there's different kinds of lessons to learn there as these things can come and go. But as a piece of policy and as a piece of health systems direction, it's a really great document. They had, I think, more than 320 national and state recommendations, and before the election, about two-thirds of them had already been enacted, many through the Medicare system. So, unfortunately, the challenge in the US is that these things do not reach everybody because of the nature of their private system. But for those who were accessing Medicare, things were beginning to get better for caregivers, and in many respects, actually better than they are for Canadian caregivers. So that was a really interesting one.
fantastic. Yeah.
Questions about the slides? Yes, we do have some articles coming out about the data, so I can connect you to that. And we do have the full survey as a referenceable, the survey report as a document, so we can include both the exec summary and the full survey. You can cite. Yes, easy citing.
Wonderful. Well, I'm just wondering, I don't see any hands up or additional questions. So just again, thank you so very much. Been really very impressive what you have achieved in what was 2.5 years already in terms of the impact and everything. So
Thank you.
really
We all
setting the
need a
bar
nap
high.
over here.
Yeah. Okay, well, please join me in thanking Liv for really a really spectacular talk and great informative seminar. And I think all the positive comments speak very loudly about how much this meant for all of us to learn from you. Thank you.
Thank you so much. And to all of you, don't hesitate to be in touch if we can support your work. We're so impressed with both centers and again, have some connections with both. So if there are ways we can support your research or connect you to caregivers with lived experience to participate in your research, don't hesitate. Our doors are wide open, and we look forward to collaborating with you all.
Beautiful.